Okay, before we even start describing the heart as an organ, I think it's very important to have the big picture of what is going on in this system so we can easily understand the anatomy of the heart. And now there's few concepts that I want you to have ready right now. One, and look that I'm using blue, are veins. And veins are blood vessels that are going toward the heart. That's the definition of a vein. And we have, it doesn't matter, by the way, if it's carrying oxygenated or deoxygenated blood. That is not a parameter to define a vein, because we are going to see we have veins that are carrying deoxygenated blood, the blue blood, which is not blue, it's just darker. And we look at these veins in here, they're going toward the heart, yet they're red because they're carrying oxygenated blood. So the fact that they carry oxygenated or deoxygenated blood is not a parameter to define what is a vein or what is the artery. Okay, so veins simply are blood vessels that are going toward the heart. And the blood vessels that are going away from the heart, we call them artery. And I put this, blue and red because usually that's how they are labeled everywhere. But the color in here, what is meaning or what is trying to show you is that there's one type of blood vessel carrying deoxygenated blood with poor oxygen concentration, which is darker. It's the blood that you see when they draw blood from when you go and get your lab work done. That is the color of venous blood. It's darker. If you see the blood in an artery, it's still red, but it's shiny, bright red. That's the arterial blood. Now, and that's why it's red. The other concept that I want you to have here in mind is atrium. What's an atrium? Atrium is when you go to let's go to an atrium. That's the entranceway, right? The atrium are chambers of the heart, these two upper chambers of the heart that receives blood. So they only receive. And if they're receiving blood, they receive because atrium is singular, atria is plural. Okay, so veins empty the blood into the atrium. Okay, veins get to the heart and empty the blood into the atrium. So atrium are the receiving chambers of the heart. And then we have ventricles. That's an S. Ventricles. The ventricles eject blood. Okay, or those are the ones that pumps the blood. These inferior two chambers, one on the right, one on the left side, they pump the blood out of the heart. And two other concepts is that the entire circulation is divided into a pulmonary circuit and a systemic circuit. Okay, so the pulmonary circuit only encloses two organs, the heart and the lungs, the right and left lung. So the heart receives deoxygenated blood that is collected from the entire body through these two major veins. This is the superior vena cava. Here is vena cava. This is the superior one, and this is the inferior. So the superior collects the blood from the superior portion of the body, and the inferior from the inferior portion of the body. All of this is inferior, all of this is superior. And this deoxygenated blood or poor oxygen blood gets right here into the atrium, passes to the ventricle, and from there it goes to the lungs, okay, to the right and the left lung. Can you see that? And it in there in the lungs, what do we have in the lungs? We breathe in and we're bringing the oxygen inside. And the blood, as it passes through all of these capillaries on the lung, picks up the oxygen, and now the oxygen gives the bright red color, arterial color of the to the blood. But now it returns to the blood. It returns to the heart, but now to the right, the left side of the heart. And all of this returns to the heart, following what? Arteries or vein? What do you think are these? They are going to the heart. They are veins, but they're red because they're carrying oxygenated blood. It's fresh blood coming right from the lungs. Okay, so this is the beginning of the systemic circuit where the left atrium receives oxygenated blood from the lungs, passes that blood to the left ventricle, and the left ventricle pushes that blood. This is the valve, and it goes this way. It's located behind this blood vessel, and that's the aorta that delivers the oxygenated blood throughout the entire body. Okay, so let's keep this concept: veins, artery, atrium, ventricles, and the two circuits here as we described the anatomy of the heart. See you in the next video.